Larry Hayes will lead us in the invocation. Oh, I'm sorry. Stacy, who I got building next?
I got this group right here. The Kinlaw girls.
Okay.
Kinlaw girls.
And Kinlaw girls will lead us in the pledge of allegiance. Please stand for prayer.
Let's bow our heads. Father, we thank you for your presence here. And Father, we thank you for these commissioners. Lord, they work and labor hard. They're tired. It's been a long day. God, give them wisdom, give them strength, give them that godly knowledge that they will discern for the very best of Bladen County. Bless these young folks as they pledge allegiance to the flag we so much love. Thank you, God, that looks over our county and our country. Thank you for our attorneys and all our department heads. We ask these things in Christ Jesus' name and all of God's people. Amen.
Amen. Stacy, will you come introduce them?
I sure will. I don't usually get to come before I guess that I'm related to these. I'm Stacy Kinlaw, Bladen County 4-H agent. These are three of our 4-Hers. This is J.C. Kinlaw. This is Kenzie Kinlaw. This is her first official year in 4-H. She's been doing it for a few years. And this is Ellie Kinlaw. They're going to turn around and lead you in the pledge of allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I got something for you, little girls. Not much. You probably won't ever wear it. Little pin, those counties said that y'all do trust. Thank you very much. Okay, we're going to send out the commissioners. I'm going to move this agenda around a little bit tonight. We're going to approve the consent items, and then we're going to go back into mental health. If that's okay with the pleasure of the board. Somebody else make a motion. Motion by Mr. Cogdill, second by Mr. Bullock. Any discussion? All in favor say aye. Aye. All right, mental health. Ms. Sarah, you want those, y'all want to present, and then, I'll let y'all go home. Thank you so much for bearing with us.
My name is Melody Campbell, and I'm Carolina Computer Agency, and we've been open for 23 years. We have a psychiatrist on board. He provides medication to our clients. We specialize in IDD. That's intellectual developmental disabilities. It used to be called mental retardation, back in the day. And we service most of our clients out of their home. That program used to be called CAP, MRDD, but it's now called the Innovation Waiver. All our clients, they're mostly on the waiver. And what we do is we go out to the homes and we provide, basically it's called community living and supports now, but it's the old personal care and in-home skill building. And what we do is we basically take care of the clients. We assist them with their bathing, their dressing, their grooming. We help them brush their teeth, transferring any ambulation if they need assistance in their wheelchairs, getting in and out of the wheelchairs, getting in and out of the cars, preparing meals, and assisting with their medications. In addition to that, we also take them out in the community where they can go different places, Walmart, Rose's, the Fayetteville to the mall, anything that, gets them back out to the community, the parks and stuff like that. We also assist them in budgeting their money and banking, they can get their own personal account and, learn how to write checks or use a debit card and stuff like that. And we assist them with basically a lot of self-help skills, so, they can be productive members of our society also. We are located right here in Elizabethtown on 1107 East Broad Street. That's where we provide those services at. And we also have another office here in Elizabethtown. It's on Swansea Street. That's where we do our day program at for the IDD consumers.
Okay, she mentioned day support. I'm Lynn Spalding, I'm mental health director, day support director. And those individuals that live in their homes that are able to come to the day support program, that gets them out of the home and they come from 9 o'clock to 3 o'clock. And it puts them in a totally different setting where they learn management skills, budgeting skills, how to, arts and crafts. We do arts and crafts with the clients. We teach math skills because all of these clients are on a very low functioning ability. So there are 2 teachers. I'm one of the teachers and there's a teacher in here also. And they also learn to read. We do writing with them. Many of them, some of them do not even, have never been able to even learn their alphabet. We work on their level to progress them further. So that gets them out of those homes or out of the group homes and gets them to come to us, which they feel good about getting out and having something to look forward to each day.
And we also provide respite services, and that's when the consumer's guardian or the parent or the grandparent, they can get out and they can go and do some stuff that, they normally do work or just go on, go out to eat or, they going on vacation or something like that. We provide respite services, while they're gone, for their loved one. And we also do residential supports. We do that in Bladenboro, North Carolina. That's connected kind of like with the group home. The group home is a 5600C. That's for IDD clients. They're there. They have to be at least 18 years old to stay there. And we provide them, medication management, basically, assisting them with bathing, grooming, dressing, or, transferring, getting out. The same thing in the group home. And the behaviors, teach them how to, manage their behaviors and stuff like that.
Anyone have any questions?
How do you typically refer to, how does a patient or someone uses your services?
Usually,
Refer to you?
yeah, usually from a state hospital, Cherry Hospital, Eastpointe, Trillium, family members, Lumberton Hospital.
So you work with both, Eastpointe, Trillium, the state, everybody, it's not, you accept everyone?
Yeah, and Bladen County, yeah, but they have to have the, IDD disability.
Sure.
Yeah.
Thank you.
What's the name of your company? I didn't hear
Carolina Care Agency.
Carolina what now?
Carolina Care.
Carolina Care.
Carolinas
Care.
Home Care.
How many people patients or citizens are you seeing?
We serve in 61 clients in Bladen County at the present time.
And all over the county?
Huh?
All over the county?
Yes.
Okay.
Yes, sir.
And y'all the ones located out here on the end, near Bladen Builders?
Yes, we
That's where you
located
guys
right there,
work
that's
at?
in Swan, that's our office on
On
Swansea
Swansea,
Street.
where you do that?
Yes, sir.
What is the physical address in Bladen?
I'm like at 1468 Richardson Road.
Do y'all have signs, some big banner, some up so the public can know where you?
At the office locations we do, but not at the group home in Bladenboro. Because they want them to live in the community as normal as possible. Like this is a facility.
Okay. Thank you.
You're
Thank you
welcome.
for waiting for us.
You're welcome.
Yes, ma'am.
Hello, thank you for allowing us to come today. My name is Dawn Bass, and I'm the Clinical Operations Manager with Monarch. And this is Miss Tanya Locklear. She's the team lead for our mobile crisis team. She's going to pass out some information about Monarch. Monarch does offer some different services. However, we're going to talk about our mobile crisis service today. I took my little glasses on. So Monarch was established in 1958, and it provides support statewide to thousands of people with intellectual and developmental disabilities. mental illness, and substance abuse challenges. It's a nonprofit organization. What we wanted to talk about today was our mobile crisis services. And those are provided to children and adults. And Monarch's mobile crisis services are available when there's an immediate need for someone to come out. Our mobile crisis team is available 24 hours a day, 7 days a week, 365 days a year. And it's for any individual that's experiencing a mental health or substance abuse need in their home, in their community, in their school, anywhere. Our mobile crisis teams are trained to come in, evaluate, try to de-escalate the crisis situation at hand, and assist them in getting services. And Monarch Mobile Crisis provides these services in Bladen, Columbus, Robinson, and Scotland. Now, once we go in and de-escalate the situation, we do attempt to assist the person with locating and linking them with resources specific to their crisis situation, as you were talking about. And we try to meet them where they are. We've met them in Walmart parking lots. We met them at their home, at the school. Probation office calls us a lot. We work very closely with Eastpointe. Eastpointe dispatches us out. And Miss Tanya gave you a card. That is our own mobile crisis MAPS line. We call it our MAPS line. And anyone in the community can call that number, and they'll get someone live on the phone. And I'm going to let Miss Tanya take over.
Basically what it is, when Eastpointe was telling you earlier, when they triage a person and screen them, when somebody calls the call center, they get a screen and triage. Their triage is emergent, routine, or urgent. When they're triaged as emergent, Eastpointe calls our team, which is the mobile crisis team. We go out in the community, anywhere that person's located at in the 4 counties. We do serve Bladen County. We have been out anywhere in their homes, to the school system, the probation officers, at the hospitals, at the doctor's office. So when that person is triaged as emergent, we go out, we de-escalate the crisis, we stabilize it, we come up with a crisis and safety plan, and then we link them to services. Or we involuntarily commit them for a higher level of care if they're a danger to themselves, or if they voluntarily want to go up to a higher level of care, which is a hospital. So it's basically what we do in the community.
When they're IVC, law enforcement picks them up and they're transported to the hospital.
Yeah, we've had the magistrate's office that called us a couple of times as well. They have our number, they have our card. So when a family member's concerned about their child or concerned about their adult child, they go out and they try to involuntarily commit themselves. The magistrates automatically calls us to assist because they need a mental health assessment. The family just cannot petition and involuntarily commit somebody on their own knowledge. So when that happens, the family calls us. If it's an adult child that the family does not have legal guardianship over, we can't do anything. So basically, a lot of these substance abuse users are not trying, when they don't try to get help or they don't want help, but their family wants them to get help, it's totally up to them. They can be in a crisis all day long, but until they are saying they want assistance because they're their own legal guardian, we can't overstep their rights. That makes sense?
Unless, the parents are the guardians.
And if the child is, like you said earlier, under the age of 18 and they call our crisis line, we do not need the consent for the parents to go out and do a crisis assessment. We can go out on our own will based on triaging that child as emergent. If the school care system calls us and they can't get in contact with the parents, if that child is deemed as emergent, we can go out without the parents' consent. However, it's best practice to get the legal guardianship involved.
And we do attempt to contact the parent or guardian en route to the school where we have a 2-hour time frame state mandated that we meet. We try to get there before 2 hours. We do have a 5-team full staff rotation. That's not counting Miss Tanya, she also takes call. We try to link them, it's called provider choice. Basically what that means is we ask them, where would you like to go for services? They don't have to come to Monarch just because they receive services with our mobile crisis team. You know, if we received a call from Eastpointe and they were dispatched through Eastpointe, we most definitely try to call Eastpointe back at the member call center and link them with their provider of choice. We always offer that. If it's a community call that we receive, we try to link them with the provider by calling the provider ourselves and linking them with the provider that they chose. We do provide 24 and sometimes later than that follow-up with the individuals that are in mobile crisis. If it's a child, we follow up with the child's family. We do try to also provide resources. We have linked several with the Hope for NC, one of the resources that all of you have been informed about since the hurricane. We've had an increase in mobile crisis calls, and they've helped with furniture and different things. So we have been using that resource. So, go ahead.
Even when a person calls in for Eastpointe and they want services and they're deemed as emergent, if they're their own legal guardian, they can refuse the right of mobile crisis services. If that happens, Eastpointe immediately calls a wellness check and sends somebody of police to their home, or sheriff department to their home to do a face-to-face. So they can deny mobile crisis services. They're not mandated to take our services. It is voluntarily. But we do provide detox and withdrawal services. At Monarch, we have that, which is a 3 to 7 day withdrawal for detox and substance abuse, or 7 days for depression or mental health. Facility crisis-based center is located in Lumberton. There is another substance abuse facility located in Bladenville called Crossroad. Yeah, Southeastern Crossroad. And that's a 42-day program that, you know, they can assist to see if they can get in there.
We are working on IVC. We're working towards that at our Kangaroo location.
What's that for IBC?
Involuntary commitment.
What that is basically if we deem that you're a danger to yourself or others, we'll go to the magistrate, we'll present how we felt that you were a danger to yourself or others by your symptoms. Then the magistrate will deem whether he should pull your rights away from you, your civil rights. Once that's done, then they'll initiate that IVC order, and then the law enforcement will come pick you up. Sometimes that happens if they're in the outpatient clinic, but if mobile crisis goes to the home, and that's going on within the home, they'll go to the home setting and pick them up. And those are good for 24 hours if they leave the home setting, but that IVC order is still good for 24 hours, so they'll continue to look for that individual.
So in other words, when somebody, we go out there and we do the assessment, and initially they do want services, but they don't want to go to a higher level of care, and they're a danger to themselves or others, we deem them as a danger, so we take their rights away and involuntary commit them to the hospital.
And sometimes that happens with children as well.
And then the legal guardianship doesn't have any rights either. It's up to, once they get to the hospital, it's up to the doctor to determine if they're going to continue to keep them, to send them off to a hospital that can provide psychiatric services, or the hospital can reverse it and say they're safe to go.
How did you get rights from it? How do you?
Involuntary commitment, we petition in front of the magistrate.
The magistrate, we don't know.
That's just the language I'm talking about. We
The
petition in front of the
magistrate,
magistrate.
yes,
The
ma'am.
magistrates usually agree with us.
I noticed you're located in 5 counties. Do you have any future action plans to locate in Bladen?
We're located in 4 counties. We do services in 4 counties.
We come to Bladen. Mobile crisis is a mobile
We
service.
travel.
Yeah, I'm looking at your locations
Oh,
here.
you're talking about the offices?
Yeah.
Yes.
Nobody want to come to Bladen?
I'll have to check on that, but I know that right now it's Lumberton and Wyoming, yes.
We need somebody here.
You need somebody.
Yeah, I understand. We do link them up with services providers that have transportation, and we link them up.
One question, I know that, most places when they get committed and they have to go to the Lumberton Hospital, whatever, like you said, due to Medicaid and Medicare, it's 3 to 7 days. And right, we have Carolina Crossroads here, but I just know if someone just recently witnessed this situation, obviously they have to release them after those so many days because the funding is gone. But the family was at a loss, what do I do with them now? do you fall into that service that may be able to assist or Eastpointe?
Well, the hospital, once the hospital discharges them, they usually supposed to discharge them with a plan of action. And the plan of action could be follow up with outpatient services. Once they link us for outpatient services, if we feel like they still need a higher level of care or long-term treatment, we link them up to services that can provide long-term treatment.
And Eastpointe does assist too with the care coordination department. Anytime, there's an issue with need of services, or you can't necessarily get them linked in quick enough, Eastpointe, their, system of care coordination department can always assist with that.
If you have a child and you communicate with parents on those, well, do you ever communicate with, what's it take you to communicate with the teachers and the social workers and the guidance counselors?
We work with them very closely. They call, the mobile crisis team, probably more so than the
They call
parents.
us very often. They usually use our 1-800 number that we provide. They call us directly, we screen the child, and we go out. We can't disclose information for as medical because that's confidentiality unless the parent gives us consent to disclose that information to the school.
So do you seek that consent so
Yes.
that teachers and guidance counselors?
Yes,
social workers
absolutely,
will be
because
aware?
sometimes the school refuses to allow the child to return back to school if they have a mental health assessment.
And we take a collaborative approach, so it's an interdisciplinary team approach. So we want the teachers involved, we want the team approach, because that's what's best for the child.
Okay, Ms. Bree? Ms. Nelson?
Is this something that's only offered for those who need your services for the first time? And if it's not, then what are the steps that you take to make contact with the child or family, or the individual to keep them on track?
This is it's not a one-time thing. You can call us as many times you want and get our services if you deem necessary, meet the criteria to get them. But however, once we know it's a pattern, say for instance, school calls us 3 times in 1 month, that child's in crisis again. Therefore, we try to link up and try to get everybody else involved. We give a care coordination referral with Eastpointe to get them involved, but they can have somebody to contact, follow with the family to see what other outside services is needed besides mobile crisis.
Because we keep a running log of individuals that we see. So if we see you, for instance, 4 times in a month, then we know a care coordination should be completed.
Then you would link up with what would best fit their needs at that time.
Right.
Okay, great, thank you.
No.
I think I've heard of MOG and mobile. How about everybody mobile crisis? Do y'all have any type of educational component that's funded through your program where you go out and make this service available to schools, community organizations? Do y'all do that type
Well,
of thing?
pretty much the schools are very much aware of us, because they utilize us.
Do you do any other kind of things
We
with our
do.
community?
We have.
Well, I'm asking, how would that correlate if we want you guys to come out and do like a presentation like this now? Do y'all do that?
My card is with that mobile crisis card. If you just give me a call, we'll be glad to come out anytime.
Like to a church organization?
Yes, sir.
Yes, sir, anywhere you want us to go. We also attend the collaborative meetings that they have here in Bladen County and inform everybody within the collaborative meetings.
Okay, thank you, ladies.
Thank you.
Thank you.
Yes, sir, y'all coming back?
Whatever you need us to do.
So it's my turn.
Sit.
So, I know you did a survey, but is there any way that you can share with Bladen County what Bladen County needs are?
So, I
I
mentioned
mean,
this
is
famous
it broke out,
bar.
is it broke out?
What I've got here is not, it's system-wide, but, this is what I was speaking, and we can get it by county, I do believe. But the state-funded, prevalence for our system was 32,363 for 16, and 10,648 were served. So that's across the 12 counties. And you can figure Bladen County's 4%. I mean, we can get numbers, but roughly.
Yeah, that needs, and that gaps and needs, if we could, if it could be broke out for counties, I think that would help us. Okay, Mr. Priest? David? Cardell?
When I was talking with some of the probation officers, they expressed a concern that they are confronted with the issue that people go into the system, and while they're in the system, they are being treated with medication for certain behavior disorders, and they put them on those medications. And then they'll bring them back out for 6 months. The state requires for them to monitor them with urine tests and while they are in condition of parole. But once that's over in 6 months, they say then there is no service or anyone providing any type of support to those inmates, and then you got repeat offenders because they get off the medication, if they have no resources to get it, no services are here available to assist them, they don't have any work to direct them. How do we go about handling that to keep these build a new jail? We don't want to fill it up, but how do we keep them from? Is there any service that you guys can provide that would assist with that? It's like he said, some of them don't have housing, they have no place to stay, and they just got a whole lot of issues that come about. But the guys that's on medication have been handled with medication for mental disorders, and they leave out the correctional facility.
That's a little tricky when we have someone who's incarcerated, because the state also says that there is, whether or not they would be able to get the actual funding in the jails, because the jails have their pot of funding and their social workers and their doctors to assist that person. But we do, whenever a jail or prison contacts the call center, and they let us know that the person is going to be released, and I hope I'm answering your question correctly or what you're looking for. If they call us and they're saying the person is going to be discharged on, say, July 7th, then what we would do is go ahead and connect that person to a network provider for services, so that there's no break, so there's that continuity of care. And then we also get our care coordination department involved as well. Now, in terms of housing needs, we do have some resources, like the Shelter Plus grant as well, and we also have transition to community living if they qualify for that, for the transition to community living, which gives a stipend for the housing. But in terms of housing, we just link them to any housing resources that we have. And then also the Department of Social Services too, we work closely with them.
So we want a provider to provide housing, we would have to contact a provider and ask them, would they look at transitional housing, or would they someone apply to you guys that would set up transitional housing? How are you handling it?
Yeah, we don't actually do the housing piece, but we can help coordinate or find additional resources in the community to assist with the housing.
So that person will have to come to you and ask for your assistance on that.
Right.
But we do not have the funding for housing.
We don't do,
But you're trying to help find somebody that.
we try to coordinate with resources, yes, sir.
My question is a two-part. I want to know how our service or clients are notified when services locally are no longer available. And then, how are my veterans treated in between? So what happens when you get a veteran, those part? How does that, how do you do that?
Yeah, that's a great question. Our call center has been trained. There's questions to ask whether or not a person is actually in the military, active, whether or not they are veteran as well. And they also have the resources and the connections with our VA clinics as well, because our military, they are connected with TRICARE. So what we do is we connect them to the VA, because that's a different insurance that we cover. So we want to make sure that we have providers, that the person is going to the right provider that's going to cover their costs too. So that's another component that we look at as well.
But veterans do not have TRICARE and other services, but you do reach out to the VA for that.
Yes, ma'am.
But my question is then, the services that are no longer, providers, no longer available here locally, and they close, how do you treat their documents, their records, and their providers? How do you get that?
That goes to our transition team, which is a team that meets weekly that has representatives from each department at Eastpointe. so that either a provider voluntarily or involuntarily is in their contract. We can gather all the names of the members in our system that receive services in the last, whatever time frame we need to gather it. We also try to work with the provider and say, provider listing, are you going, these are the other providers in our network that do these services that will transition for care. We also send an individual letter to each one of the members, to their last known address to say, listen, if, your provider's closing or going out of operation. Then we ask the provider, what's your plan for storage of the records? Now, sometimes they may be closing a service in one town, but they're gonna continue to do it somewhere else, so they just say, well, our records are moving from Main Street to this street. If they're totally going out of business and closing in our network, not gonna be operational anywhere in the state, we require that they surrender their medical records for our members to us. We then categorize those and save those so that if 5 years from now, someone needs their records so they can apply for military or whatever, we have the records during that time frame. That's a good question.
Mr. Bullock, Mr. Dawson, Mr. Brett. How do we as commissioners know the difference between an Eastpointe qualified provider and one that is not?
Good question. One on the website, that would be providers, you saw the list of the provider names. And then also to make sure that their site is an approved site. So you could have the example I used previously, a provider that's say located in Bladenboro, it's an approved site, and they want to open a site in Harborough. They can get a license for that site, but that does not mean they're contracted in our network. So it's a very good question.
Ms. Priest, Ms. Ashley?
I know we've had some issues, here with a, life bridge, that's located in Bladen, with the family. With them having certain hours that are posted of operations and then having a telephone number that's not really operable. Do y'all have any, I know that y'all heard of this, do you have any insider update on that facility and what we can expect as citizens in Bladen County? What is the actual store folks for? Is it a walk-in between the hours they have posted, or is it not? We just need to, I think we need to really clear that up because there's a lot of confusion out there and I still haven't heard, just trying to listen without having to just ask question after question to get a response. Maybe y'all could just take a few minutes and explain what's going on with that.
LifeBridge is a provider in our network. They have approved for a site in the Robeson County area. We have not approved nor contracted with them for a site in this county. Providers can put out a sign or seek a license, which is granted through a different regulatory, but that does not mean that they are approved for a site. So at this point, LifeBridge is not approved by Eastpointe for a site in Blake.
Mr. Goodman? I'm good. Mr. Cogdell?
I've heard this from going to some meetings that some of the MCOs and LEs are paid incentives to not spend money and to save money and to keep within the constraints, and some of them are being compensated with stipends and stuff because of that. Is that a true accusation, or is that wrong? I've heard that. Is that so?
I'm not familiar with what you're
No,
speaking of.
they've said that some of the people that run the MCOs are paid bonuses and stipends and incentives to keep the money in a certain category, that they refrain from spending so much money and save it, and that's how they get, some of them get like a bonus pay from retaining so much of their money. And I can't say it, I'm just asking.
I can't speak to what may or may not be happening in other MCOs. It's certainly not happening that way at this point.
Okay. And the other thing,
Just one
the
question.
fund balance.
I'll defer.
All this is about the thing.
Very good.
When we was here 4 years ago, the gentleman came in, I think Mr. Cleo Jones or some gentleman came in, and he retired, or Ken. And he came to us and we questioned him because he said he had a fund balance of $361 million. Or something like that. He was a bunch of money. And we asked him about paying for police, guarding prisoners, and a whole lot of different things. Do y'all operate with a fund balance?
Yes, sir, we do have a fund balance. And the unrestricted amount of our fund balance at this time is, don't quote me on this, but it's roughly $37 million. But if we were to operate, if we were not to have funding, our monthly operation would be somewhere around $30 million. So any good business keeps about at least one, sometimes 2 months worth of cash. I see Mr. Britt nodding his head, he knows that to be true. So really, the only amount we have in fund balance is unrestricted would be the amount that we would need to have if funding work.
Okay, it's fine, I just want to.
Yeah, but I just wanted to update you on the amount, it's very different from what
Mr.
you're.
Allen, Mr. Brett, my question is, you talk about 45 miles, you talk about 45 minutes. How can we, or how can Eastpointe, or how can Cardinal, if they come on board, how can we join together and recruit people to come put bricks and mortar in Blaine County and let some of the other people travel instead of us having to travel all the time?
Good question.
I mean, you don't even have to answer, but I just wanted to plant that seed.
I think that's a very good question and point well taken. I do think if we go away with anything tonight though, it is the educational piece around the community-based services. I think while you do have bricks and mortar, it's really important to realize that the evidence-based services that are shown to be effective for our members, many of them now are community-based. So, as we've heard tonight, you do have a number of those as well.
And I would dovetail on the community base as to operate a business. You heard from the mobile crisis team that's active in your community, seeing people. If you said, we want you to bear the cost of monthly rent, utilities, insurance, and oversight to have a building for your mobile crisis to come out of, that's an added cost for the provider when they're already in the, they respond without the bricks and mortar.
Mobile Crisis has 4 offices in there, not one of them in Blaine County. One of them, what I was saying, one of those offices could be in Blaine County. That was a good example she talked about, Mobile Crisis. She has 4 home offices, but not one of those could be in Blaine County.